So I do think that smartphones and wearable devices will play a greater role in screening patients for any type of arrhythmia, in particular AFib or other lethal arrhythmias. In regards to monitoring, we know that remote monitoring of devices plays a significant role in clinical practice. However, I think there is still a lot more work to be done making sure that data is encrypted and can't be hacked. And I think that becomes really important if you think about the future of remote programming of devices, which would then allow the patient not to come to clinical practice, not being hospitalized, which I think is a great idea. If I think about devices overall and the technology, I think we have now more multipolar leads available for CRT implantation that allow more sites to be paced and to hopefully give patients greater benefit from CRT implantation. The idea of HIS pacing, I think, is very interesting, has been around for a while. However, it still needs some newer technologies to really place the lead at the right spot. I think patients would be at lesser risk of RV pacing-induced cardiomyopathy, and even patients who are candidates for LV pacing might be candidates for this instead of our CRT. So I do think that the leadless pacemaker technology is really something that's going to increase in utility, especially if we have the means of communication between an atrial and a ventricular device and maybe even a leadless CRT device. So I think one important point is to individualize the therapy. So if you think about genetic assessment in patients with AFib, you could think about some patients that might be more susceptible to certain antiarrhythmic drugs, or that might be more susceptible to more recurrence after undergoing a fibrillation. I do think that non-invasive mapping already has shown to be of interest, and I think there needs to be more research in that regard. There is now an interest in non-invasive ablation, which I think will be the future. The other part that is important is to improve outcome in VT ablation. Right now, outcomes is really about 50% success rate, which hasn't really changed over the years, and I think there needs more work to be done. And also we need more data on whether VT ablation improves mortality.